Today we are going to discuss the intercostal vessels. Intercostal vessels include intercostal arteries and intercostal veins. So intercostal arteries, we have the posterior intercostal arteries and anterior intercostal arteries. Posteriorly we have 11 intercostal spaces and anteriorly we have 9 intercostal spaces. So in each space posteriorly we have one posterior intercostal artery, and anteriorly in each space we have two anterior intercostal arteries. Coming to the posterior intercostal artery. Posterior intercostal artery is formed in a way that the first plus second intercostal arteries, they arise from the superior intercostal artery, which comes from the costo-cervical trunk of the subclavian artery. So a branch of the subclavian, which is the costo-cervical trunk, it gives off the superior intercostal artery from which arises the first and second posterior intercostal artery. And the third to 11th intercostal arteries, they are coming directly from the descending aorta. So the posterior intercostal artery, its origin, the first and second posterior intercostal artery are coming from the subclavian artery, and the third to 11th posterior intercostal arteries are coming from the descending aorta. They run in the posterior intercostal space, gives off a branch which is called the collateral branch, and end in a way that the posterior intercostal artery directly anastomoses with the upper anterior intercostal artery, and the collateral branch of this posterior intercostal artery anastomoses with lower it anastomoses with the lower intercostal artery, lower anterior intercostal artery. So I'll repeat this. The posterior intercostal artery, first and second, come from superior intercostal artery, which is coming from costo-cervical trunk of the subclavian artery, and the third to 11th posterior intercostal arteries, they are coming from the descending aorta directly, and they run in the posterior intercostal space in a way that they give off a collateral branch, and the direct posterior intercostal artery anastomoses with the upper anterior intercostal artery, and the collateral branch anastomoses with the lower anterior intercostal artery. The branches of the posterior intercostal artery are the dorsal branch, which supplies the back muscles, and it gives off another branch which is the spinal branch, which supplies the spinal cord and vertebrae. Then it also gives off a collateral branch which anastomoses with the lower anterior intercostal artery. Next, it gives a muscular branch which supplies the intercostal muscles plus the serratus anterior muscle plus the pectoral muscles. The lateral cutaneous branch supplies the skin. The mammary branches supply the breast, and lastly it gives off a right bronchial branch. Now coming to the anterior intercostal artery. Anteriorly we have 9 spaces. So what happens is that in each space we have 2 anterior intercostal arteries. The upper 6 spaces have the intercostal arteries coming from internal thoracic artery. Internal thoracic. And in the spaces 7, 8 and 9, the anterior intercostal arteries are coming from the musculophrenic artery. So anteriorly we have 9 intercostal spaces, each having 2 anterior intercostal arteries. In the upper 6 spaces, the anterior intercostal arteries are coming from the internal thoracic artery, and in the 7th to 9th spaces, the musculophrenic artery is giving the anterior intercostal arteries. Now coming to the intercostal veins. Intercostal veins, just like the intercostal arteries, are anterior and posterior. The anterior intercostal veins are 2 in each space, just like the anterior intercostal arteries, and they are accompanying the anterior intercostal veins. So in the upper three spaces, the anterior intercostal veins, they drain into the internal thoracic vein. In the middle three spaces, the anterior intercostal arteries, they drain in the veni comitentes of the internal thoracic artery. And in the lower three spaces, the last three spaces anteriorly, the anterior intercostal veins are draining into the veni comitentes of the musculophrenic vein. So the anterior intercostal veins anteriorly, they are two in each space, just like the arteries, and they are accompanying the anterior intercostal arteries. In the upper three spaces, the anterior intercostal arteries are draining into the internal thoracic vein. In the middle three spaces, they are draining into the veni comitentes of the internal thoracic artery, and in the lower three spaces, they are drained in the veni comitentes of the musculophrenic artery. Now coming to the posterior intercostal vein. The posterior intercostal vein drains differently on the right side and the left side. Talking about the right side, the posterior intercostal vein, number 1, drains into the right brachiocephalic vein. Then the second 2, 3 and 4, 2 to 4, they drain into the superior intercostal vein, which drains into the azygous vein. Then the remaining, starting from 5 to 11, plus the subcostal vein, they drain into the azygous directly, azygous vein. On the left side, the posterior intercostal vein, number 1, it drains into the left brachiocephalic vein. 2 to 4, they drain into the left superior intercostal vein, which drains into the left brachiocephalic vein. 5 to 8, posterior intercostal veins on the left side drain into accessory hemiazygous vein. And the remaining, that is 9 to 11 plus the subcostal vein on the left side, they drain into hemiazygous vein. So the posterior intercostal vein on the left side, it drains the number 1 for posterior intercostal vein on the left side drains into the left brachiocephalic vein directly. Second, third and fourth left posterior intercostal veins drain into the left superior intercostal vein and then into the left brachiocephalic vein. 5th to 8th left posterior intercostal veins drain into the accessory hemiazygous veins, and 9th to 11th plus the subcostal vein, these drain into the hemiazygous vein.